As the province continues to build out its involuntary care system, an important update for doctors on when involuntary care applies to kids.
This is not the solution. This is not the answer to the entire problem. This is one more tool.
The guidance provides clarity to healthcare providers about how the Mental Health Act can be applied to provide involuntary care for kids under 19.
We need to intervene to prevent brain damage and death.
It directs doctors to immediately connect with kids' parents as soon as the patient shows up suffering from a severe disorder that impairs their ability to engage in care. In exceptionally severe cases with parent consent, doctors now can provide involuntary care.
But that's kind of who he was this week before he died.
Something that doctors weren't authorized to do in 2018 for 16-year-old Elliot Eurchuk's family.
He got a dependency on them.
After several sports injuries and surgeries, Eurchuk was prescribed opioids for the pain. When those meds ran out, he turned to street drugs.
We found him in the morning. Dead, cold.
His parents say they felt trapped by the medical system that kept them in the dark about their son's painkiller addiction. They begged doctors to intervene on his behalf, but were told at 16, Elliot was old enough to make his own medical decisions.
He was a child, and a child in crisis, yet we as parents had no legal ability to step in and protect him.
Today's clarifications for physicians, Elliot's parents say, will give families the ability to intervene and save their kids' lives before it's too late. But not everyone is in agreement.
When we're talking about taking away somebody's freedom of action and placing them involuntarily into treatment, we need to be absolutely sure that that's the right course of action. And we haven't seen the evidence to support that.
The Premier acknowledges the changes may not be universally well received.
This is not an issue where everyone's going to agree. But I hope that we can all agree that we need to do our absolute best to provide frontline treatments and supports to kids if it means that they're not going to have a brain injury and it means they're not going to die of an overdose.
The new guidance for BC physicians is immediate. How it's applied is now up to the discretion of the doctors across the province.